Next is anterior cerebral artery, stroke, ACA. So AC supplies your medial portion of the frontal lobe and superior medial aspect of your parietal lobe. So when there is a reduction in a blood flow to the brain, there may be a neurological condition that can be a stroke. So first one is hemiparesis. Hemiparesis is a contralateral weakness. So what happened in the hemiparesis? There is a weakness in our lower limb and the opposite foot. For example, if there is a stroke in the left side of our brain, so there is weakness in the opposite lower limb and contralateral lower limb. In ACA, weakness and sensory loss both are more common in the lower limb as compared to the upper limb, and motor loss is more as compared to the sensory loss. So in ACA, your lower limbs, your legs are more involved as compared to the upper limb, and motor loss is more as compared to a sensory loss. Next is hemianesthesia, when there is a sensory loss in the contralateral side opposite to the lesion in the brain. Another is frontal field loss, deficit in a voluntary eye movement. So what is frontal field loss? Like visual field, like whole area when you look straight. Okay, it covers the whole area. Whenever you look this straight, this is your visual field. Whatever you see in your visual field, that is your front field. Like so, when your front field is lost, anything in that area will not be visible. Frontal field is mainly controlled by your frontal cortex. Right, so when there is a lesion in a frontal cortex, so anything in that field will not be visible. There may be a increased chances of falls. Anything in visual field will be blurred. Like your field, your frontal field prefers static voluntary eye movement. Like when there is deficit in a static eye movement, so there will be a movement deficit. Your eye cannot perform rapid eye movements. Another is abulia. Abulia is a mental confusion. So patient with an abulia in stroke, like they are commonly confused. Like any brain injury that can lead to a abulia, they are mentally confused. They have an emotional and the behavior changes, and their attention deficit, no social interest, can't initiate the movement too. Like whenever you ask them about their name, about the condition they have, they take no interest. Like they show no interest, they give no response. That is mainly abulia. Next is a memory loss. That is a long-term memory loss. If you ask a patient about their past events, they will not remember what happened in the past. So mainly our long-term memory loss occur in the ACA stroke. Next is apathic. Apathic is a lack of interest. Like patient will show no interest. Like they have a behavior issues. They are they are socially they do not interact with anyone. They have a reduced goal, and they show no interest whatever you are saying. Like when you're talking to them, they clearly lack interest in whatever you say. Another is a impulsive. Impulsive is a act before thinking. So in impulsive, what happens? Like they are hyperactive, they are agitated, like they have personality changes. Whenever your right side frontal lobe is involved, like whenever there is a right side frontal lobe stroke, so mainly a personality changes appears. The patient will be impulsive, patient will be agitated, they don't think, they just act. They are in hurry and they have a poor judgment as well. Next is akinetic mutism. So akinetic means move and speak means mutism. So they neither move and they neither speak. So what happened? Their motor functions is basically lost. They are expressionless. They don't give any expression. They don't react. They have reduced activity. Like they don't have any activity to perform, but They are not paralyzed, but they lack the ability to move. They are not paralyzed, but their activity, like their daily activities, their reactions, their their reflexes, their expression lacks, they all are reduced. They can't perform any activity and they cannot speak anything. So they lack the ability to move, they lack the ability to speak. Another is interior disconnection syndrome, cannot initiate the movement. So what happens in the interior connection syndrome? Like they can't initiate. Like if you tell them to grasp the wall, they can't initiate, or if they initiate it, they cannot end that activity.